Welcome to Variations 4. This is the hematology unit. In this video, we'll be covering question 15, 16, and 17. Our main focus being Hodgkin's lymphoma and multiple myeloma. So the differences between Hodgkin's and non-Hodgkin's lymphoma. So if we go to your grid here, your PowerPoint, then we can see that Hodgkin's disease, if you have to choose between the two of these, you would rather get the Hodgkin's disease than the non-Hodgkin's disease. And the reason for that is that the Hodgkin's disease, these are lymphomas, so they're a type of cancer that is typically localized and regional and doesn't usually involve nodes throughout the lymph system. Non-Hodgkin's is more disseminated, so as in metastasized, so that's a problem in itself, and it can involve many nodes within the lymphatic system. This can be very difficult to treat and obviously fatal. If Hodgkin's disease is captured early enough, the success rate is very high in terms of complete remission. A bit of a mess here in the concept maps, but the main points to get, in addition to what we've just said, is that we're talking about a cell called the Reed-Sternberg cell. They end up being abnormal, large, and more proliferate, more in number in the lymph nodes and bone. And that, in addition to what we've just said in the PowerPoint, is the main things you need to get out of that. Obviously, treatment success depends on which one you have and how early you catch it, or detect it, and chemo and radiation. And in some cases, if it's really localized, maybe surgery, maybe surgical removal of some of the lymph nodes. Diagnosed through lymph node and bone biopsies, blood analysis, and I've seen radiological exams where I even just saw someone get a PET scan where they noticed increased areas of heat in certain parts of the body, and that in combination with blood work, I don't know if they did a biopsy or not, but they concluded the patient had Hodgkin's lymphoma and treated it very successfully with about a year of chemotherapy. It was very successful. Okay, now on to multiple myeloma. We're just going to do a quick overview of multiple myeloma. What we're talking about is excessive production of plasma B cells, so a type of cell in the bone marrow. The problem with that is this excessive production, similar to what we saw with leukemia. Excessive production of this white blood cell leaves very little room for the production of other cells. And so you end up having anemia, pancytopenia, which is anemia, thrombocytopenia, and leukopenia throughout. Your white blood cells, your platelets, and your neutrophils become low. What's the problem with that? Well, again, you need to review what we've talked about in terms of anemia, thrombocytopenia, low platelet counts, risk for bleeding, neutrophils, risk for infection, all that stuff. So you're seeing similar themes, and if you remember when we first started this unit, this one falls under the theme of there's too many of something being produced, but then too many of these B cells being produced in multiple myeloma ends up causing too little of other cells being produced, RBCs, platelets, and neutrophils. What are the treatment modalities for multiple myeloma? It's not going to be too different from what we've discussed above, generally speaking. Obviously, chemo and radiation, typical cancer treatments, corticosteroids also to help suppress bone marrow activity, the bone marrow transplant if that's possible. This is something that is seldom cured, but rather just put into remission for a period of time.